Hi Facebook family and friends. Happy Wednesday. It's the Wednesday Facebook Live session. I'm Dr. Abby Connell with Carolina Hearing Services in Charleston, South Carolina. And today's topic is ear pain. Everybody gets ear pain at some point or another, but we don't always know why we're getting ear pain. So I'm going to touch base on some of the most common causes and offer a few tips and tricks for alleviating the pain or knowing if you need to seek medical attention. One of the primary causes of ear pain is actually an overabundance of earwax. So I know most people don't like to talk about earwax. It seems like it's such an odd thing to discuss, but in my line of work, we talk about it and see it every day. When we get a buildup of earwax, especially in our ear canal where the wax is formed, right down that long opening that goes into our ears, we naturally create earwax. It's actually a noxious substance to bugs. That is genetically why we started to produce wax in the first place. Nowadays, with advents of indoor plumbing, heating and air conditioning, and really just having more sanitary living conditions than we did a century ago, we don't produce as much, but some people do produce a lot more than others still, just genetically. Typically, when you let the warm soapy water run through your ear canals in the shower, it's going to rinse out all of the excess or newly formed wax, which is kind of soft and honey-like, and that warm soapy water just flushes it out. The eardrum protects the middle ear from getting any water in it. So the old wives' tale of not letting water flow into your ears is not always pertinent for every single person. So cleaning out your ears is super important. A big no-no is Q-tips. You'll notice right on the package, it actually states that you should not put them in your ear canal. No matter how much you get off on that little tip and feel like you got a nice clean ear, more is being impacted down and causing an actual earplug in the canal that can lead to severe pain as well as ear infections in the outer ear. So if you're suspecting that you may have earwax, the best thing to do is go see your hearing healthcare professional or even an ear, nose, and throat physician. Primary care physicians don't always feel comfortable getting the wax out of the ears, so seeing an ear specialist is very important. As a doctor of audiology, earwax removal is within my scope of practice, and I've also had additional trainings and certifications in earwax removal to do so safely. Air pressure. Air pressure is another big one, another one of the more common causes of ear pain. Our middle ear system is actually filled with air. And when we swallow, when we yawn, even when we just blow our nose, we have a natural system in place that pressurizes the air pressure in our middle ear system to make sure that the air that's filling our middle ear cavity is the same pressure as the air in our atmosphere. Sometimes if you've ever been on an airplane and you find yourself feeling like your ears are getting really clogged and they start to hurt, that means that the body is not able to equalize that air pressure the same way that it would if we were not descending or ascending and changing that air pressure in our atmosphere so fast. Other people mention that they get that same ear pressure if they're driving up windy mountain roads or even sometimes going up or down in elevators. When our body cannot regulate the pressure within our middle ear system with that in the atmosphere, it creates an actual retraction or a pulling back on our eardrum that really adds a lot of pressure and pain. Most of the time, if you've come down from descending in an airplane, that pressure will equalize over time, typically within a few hours. If it doesn't, and it's there still for a few days, that's when you may need to seek some medical treatment. But usually it will equalize on its own. You can also chew gum or try to elicit a yawn or even blow your nose or do what's called the Valsalva technique, which is where you hold your nose and blow. And that also creates that equalization in air pressure in the middle ears, and alleviating the pressure typically will alleviate the pain with it. Another common cause of ear pain is swimmer's ear. When we are swimming, particularly in man-made lakes or ponds, there is not always any kind of filtration system. There's very rarely any kind of filtration, but the bigger issue is that there's a lot of bacteria in man-made lakes and ponds. Even natural occurring ponds, if they are not being infiltrated with any kind of other streams or rivers where there is no natural water flow, the bacteria that starts to breed within those types of water sources can then infect or add bacteria into the outer ear canal. If it's getting trapped in a lot of earwax, you're almost definitely going to end up with an outer ear infection, also known as swimmer's ear. Swimmer's ear is not just that you got water in your ear, it's that the water that was in your ear actually had bacteria in it, and that bacteria is what creates the outer ear infection or swimmer's ear. So if you have been swimming in ponds or lakes, you want to make sure that as soon as you get out of that water, you dry your ears really well with a towel, and if at all possible, right away or as soon as you can, rinse both ear canals with fresh, clean water from the shower or from the sink so that you can get that bacteria rinsed out, and then dry your ears really well with a towel. Again, no Q-tips. Middle ear infection. So I just mentioned swimmer's ear and outer ear infection. The middle ear infection occurs most of the time when we have a lot of pressure or even sinus mucus that is not draining when you blow your nose. When your sinuses are so impacted with mucus and infection, it can back up and actually clog what would otherwise be your air-filled middle ear cavity. So in those cases, you typically need to seek medical attention from an actual MD, preferably an ENT physician, because they can look under the microscope and determine if there is just infection or if there's also fluid built up that has become infected. There are different treatments for different causes. If the cause is just fluid, they're not necessarily going to treat that with an antibiotic. If, however, that fluid is infected, it's going to get thicker and an antibiotic is absolutely required. Sometimes they can treat those middle ear infections if it is just fluid, for example. They may use something like a decongestant. But anytime that there is infection of the fluid or actual mucus that's built up that is infected, it definitely requires antibiotic treatment. And finally, something that a lot of people don't talk about too much or associate with ear pain, but is more common than you would think, is TMJ, or any kind of dental or jaw problems. The temporomandibular joint is the joint that connects our upper and lower jaw. But you'll notice that that temporomandibular joint is right by our ear canal. So every time we open and close our mouth, our ear canal is actually moving. Sometimes you can actually hear the movement of that jaw. Some people get popping in their jaw, or you might feel like you hear a little crackling in your ear when that happens. But historically, over time, that temporomandibular joint, when you do in fact have TMJ, there's a lot of bone-on-bone movement, and that can create some severe ear pain. Also, if you have any kind of cavity or a tooth abscess, or if you have any history of root canals or even dental implants, any infection or issues with anything in the jaw can also radiate to the ear canal and create ear pain. So sometimes when a physician or an ear, nose, and throat doctor, or even a doctor of audiology like myself, sometimes we can't find an actual cause to that, and we will make a referral back to your dentist to actually be evaluated for TMJ or any other kind of abscess or cavity or something of that sort. So the etiology of ear pain doesn't always start from our ears. Most of the time it does, but not always. Anytime you have any kind of ear pain that is severe or radiating down the neck or creating any other issues, you always want to seek medical attention. If it's something that's more chronic or something from flying or those pressure differences like driving up in the mountains, they will typically resolve on their own, but when they don't or the pain is severe, you need to make sure that you seek medical attention. As a doctor of audiology, I can always help you with that earwax removal and can help to diagnose the problem and make sure that we refer you appropriately either out to an ear, nose, and throat physician or to a dentist. And we always will make sure that we can help get you and your pain taken care of. Thanks again for watching our Wednesday session. I will likely see all of you next Wednesday. Topic will be a surprise. I look forward to it. If you have any questions, you can always reach out to our office directly, 843-556-4327. Have a great rest of your week, everybody. Thanks for watching.